Welcome to Zeal, Aging Redefined, where we're changing the narrative of aging and inspiring women 40 plus to age with boldness, confidence, and kick-ass positivity. So join me each week as we have real talk conversations to ensure that people know maturity brings strength, wisdom, and superpowers. Welcome to Zeal, Aging Redefined, where we're changing the narrative of aging and inspiring women 40 plus to age with boldness, confidence, and kick-ass positivity. I'm Stella Ringer, your Chief of Aging Fabulous, and we have a fabulous show for you guys today. We've got someone with so much energy, so much knowledge around sex. Oh, I mean sex. It's going to be awesome. Again, we have an expert who is the Associate Professor of Medicine at the University of Miami and a certified sexologist. Now, we're going to figure out what that is because I'm real curious. And her name is Dr. Sanjaya Kenya. Welcome to the show.
Thank you so much for having me, Stella. What a pleasure it is to be here. I'm so excited.
So glad you're here. Thank you so much, because this is a topic, as you know, Zeal Aging Redefined is all about informing and educating women through this aging journey, right? I've talked to so many fabulous women this week around relationships, around fashion, and today it's going to be around sex and how our bodies change as well. So, but the first question is, please tell us what a sexologist is. And did I say that right?
You absolutely did.
Okay.
You absolutely did. A sexologist, or I help people have better sex, in short. That's it. And this is over the lifespan. So some people, when they're young, they really don't know how to have good sex. They really are not familiar with strategies that can produce an orgasm or produce some really fun sex. You know, just because they're doing it doesn't mean they're enjoying it.
Right.
And as we get older, things change.
Right.
So I also work with a lot of people who are recovering maybe from breast cancer, ovarian cancer, prostate cancer, people living with diabetes, people living with cardiovascular disease, people who have survived trauma. And also, there's a lot of people out there who understand there is another level of sexual pleasure that is out there. How do we reach our ultimate sexual potential? And that's what I help people do.
I'm getting
If you're gonna have sex, it might as well be great.
and enjoyable and just
All that
of
good
that.
stuff, right? I said there's no sense in going to the airport and missing the plane, girl. Right? Right? So if you're gonna have sex, a lot of people ask me, what's good sex? And I say, did it produce an amazing orgasm?
then
And
that's good.
Then it's good. Now, when they ask, what's an orgasm? I say, let's talk.
Okay, let's talk then.
Yes.
Let's talk then. So tell me, in your expert, just medical history, talking to people about living their best sex life, if you will, why do you think sometimes there's an issue with talking about it?
You know, we live in a society, unfortunately, where sex is still a taboo issue. Even though, with me being a professor of medicine at a medical school, I train future and current physicians how to treat their patients' sexual issues.
Okay.
However, it's still not standard in medical school to learn about sex.
Got it.
So we have health professionals out there, many of which don't know anything about sexual health. I went to Catholic school for 12 years. I can remember asking my biology teacher, what does it mean when someone gets wet? And she said, you'll find out when the time is right. That was definitely inadequate education, and it didn't prepare me to have a conversation with anybody, nor did it prepare me to explore what feels good sexually, what turns me on, what do I not want to do, and what do I want to do. So I think our major sex challenge in the United States and through the course of our lifespan has been that it's still a very taboo issue, even though we know scientifically that people who have great sex, orgasm-producing sexual relationships, we know that they're happier, healthier, wealthier. Who doesn't want all that good stuff, right? So
I'm experiencing it. Yeah.
right? It's
Okay.
a very integral part of our overall well-being.
Yeah.
And we also know, when that person cuts you off on the highway, or if you're in an office situation where they cut in front of you in front of a copy machine or whatever, they steal your pencils,
Right.
then they come in one day and they're all happy. We're like, ooh, they got some last night, right? And then when they're stealing your pencils, they're like, somebody needs to get laid, right?
Either or, right?
And so even I think on a basic level, we understand there is some sort of physiological response that comes from good sex that does make us feel better, that does make more people want to be around us, that does help us exude pleasure to all of the people who we encounter.
Yes.
So I think it's a very, very important health issue, but unfortunately it's still very taboo, which is my mission is to help everybody have great sex because I want everybody to feel healthy, feel happy, to reach their ultimate wellness potential.
We say age out loud, so it's sex out loud. as well.
Absolutely, absolutely. And you know what I tell the religious people, a lot of people say, oh God, oh God, oh God, God wants us to have great sex.
Exactly.
Absolutely.
He created it.
Created. You know what sex could have been? It could have been like this. Ooh, you're pregnant, right? But that's not how our God made it. Our God said, you know what? Let's see if we can make women have an orgasm, right? And we know orgasms, there's no biological function for orgasms.
Right.
The only purpose of an orgasm is for women to experience pleasure. Men must have an orgasm to procreate, but women don't. So I say that is God's sign saying, you know what? Sex should be fun.
Yes.
So let's
And
get it.
enjoyable.
Absolutely.
And let's talk about how it could change, maybe not change. Let's understand our bodies and how they change as we age. And then how do we either adjust the sex? I don't know if that's the right word. Help us understand that as our bodies change, as we get older, as we age.
So a lot of things happen as we age, right? Women, we have a lot of estrogen changes, and estrogen is our main sex hormone. We also have testosterone and other sex hormones, but estrogen is our main sex hormone, and our estrogen levels change as we age, and they decrease, and that impacts a lot. That impacts our lubrication, that impacts our levels of desire, it impacts a lot of different things. And for men, a lot of circulatory issues happen as they age, which impacts their ability to become erect. If you have poor circulation due to metabolic problems, diabetes, heart disease, 12% of men find out that they're diabetic because they have erectile dysfunction. So they go to the doctors for erectile dysfunction, and that's when they find out that they're diabetic. So our hormones change and our health behaviors change as we get older, which is why many people as they age do experience diabetes and heart disease. So I like to think about it as play. If we can do the things we did when we were young, if we can stay active, which also reduces our risk for diabetes, it also reduces the risk for not being able to perform sexually.
Got it.
And for women, I think it's incredibly important, one, to be aware of our estrogen changes, and also to know what can I do holistically, maybe pharmaceutically, what can I do to sort of maintain a healthy level of sexual functioning and sexual desire. Not to say that 20-year-old sex is better than 40-year-old sex.
Okay.
A lot of times 40-year-old sex is better because you know more.
Right.
So you might get wetter when you're 20, but it gets better when you're 40.
I love it.
Because you know how to address it and talk about it.
Right.
You know what you like.
Yeah.
And hopefully you've developed the skills to communicate with your partner because you know what? People are not mind readers.
Yeah.
And sexual communication is one of the strongest components to sexual pleasure.
Now back to the estrogen levels. What level does it vary per person, or is there like a number or something you should know, or?
Everything varies per person. We're all individuals, which is why, what your man's ex-girlfriend liked is very different than what you like. You know what I'm saying? Because you're different. You're not your man's ex-girlfriend, right?
Right, I'm better.
So sex is a very personalized experience, as it should be, right? But when women get closer to the age of menopause, you know, when our menstrual cycle starts to change and perimenopause, that's when our estrogen levels change. And there's a lot of things that we can do about this naturally and pharmaceutically. There's a lot of different strategies that we can take to maintain lubrication, to maintain desire. But a lot of this has to do with, I would say, courage. Courage to address these issues with your partner. Courage to talk about this in an open format so we can figure this out. And I think if we can have more courage, and I think things that you're doing by bringing this really important issue to the masses, more of this will lead us to pay attention to what can we do. Maybe I'm just not drinking enough water. And that's something as simple as increasing your water intake can actually transform your lubrication potential as well. And people don't think about those things.
I had no idea that was the case.
Yes. And unfortunately, we have a lot of cancer survivors at younger and younger ages. So there's a lot of 30-year-old women who have survived breast or ovarian cancer and may be going through menopause at a much earlier age. And so natural things like making sure that you're fully lubricated, like making sure your pelvic floor is as strong as your biceps, right? We think about these. These
and
are
how
muscles
do we do
down
that?
there.
Yep, I've heard of the little, I don't know what you call them, crunches.
Yes,
but
Kegels.
Kegel
exercises.
Yes,
and we can do them right now, girl. Let's do it. Let's do some Kegels right now. Let's do it.
Okay, how do we do it?
So we're going to pretend like we have a straw in our vagina.
A straw.
We have a straw in our vagina, right?
Okay.
We have a straw in our vagina.
Straw.
And the room is flooding. The room is flooding. Oh my God, the room is flooding. It's flooding. I got to suck up all the water with my vagina. So let's go, girl, suck it up. Squeeze. Suck up that water. Let it go. Squeeze. Suck up that water. Let it go. So I always encourage women, when you're sitting in traffic, your car floor better be flooding when you're sitting in traffic, right? You squeezing and sucking it up. Squeezing and sucking it up. And you can ask any man who you have ever met, they always remember the woman who can squeeze.
Okay. All right, ladies.
You want to be
We
unforgettable?
got to squeeze. Don't squeeze the Charmin. Squeeze.
Yeah, squeeze those vaginal walls, ladies. It's just as important as your squats, as your crunches, And
it doesn't matter what age as it relates to
it doesn't matter what age. And there's so many tools, too.
Okay.
You can buy Kegel weights, like anywhere, and the bigger, they come in a set of maybe 3 or 6. And you might put a large weight inside of you, and it's very lightweight. Right? So you're getting used to squeezing and squeezing. And then when you can walk around the house in that and you can squeeze and it's not falling out, then you can progress to a smaller weight that's a little bit heavier, right? And then you progress to a smaller one that's a little bit heavier. And by the time you get to the smallest, heaviest one, girl, those vaginal walls are like,
You're Arnold Schwarzenegger.
Right? You can open up a pistachio, girl.
Love it. I love it.
They also have a lot of electronic devices you can buy. You can buy them right online, devices that are electromagnetic. You can put them inside of you and press the go button, and it'll do the squeezing. It'll stimulate your vaginal walls to start squeezing on their own for 20 to 30 minutes. And you might get, 300 strong Kegels in, and you can change it to different settings. And these are available over the counter, without prescription. And now they're really marketing things to women who are over menopause. They have like biker shorts now that you can wear, which are electromagnetic.
What?
And you press that button, girl, 30 minutes a day, 12 weeks later,
Wow.
you have some really strong vaginal walls. And that's not only important, urinary incontinence, 70% of women are gonna experience urinary incontinence at some point in their lives. So doing Kegels not only can improve your sexual satisfaction for you and your partner, but it can also help, delay or prevent urinary incontinence. So it's just like all of the muscles that we have to work out as we age, know, and these are an important, often forgot area, but really, really important and really can really increase sexual satisfaction for both
I love
partners.
it. Okay, I need to, find out all that information when we're done again on that. So let's go back to lubrication. And you mentioned water intake, etc. What else? Because funny story, this really happened. There's a young lady that I know to the salon that I used to go to a few years ago. I saw her, told her about Zeal. She was always hilarious anyway, but her first question to me after I told her about Zeal, Aging Redefined, she's like, do you still get wet? You still have sex? Like, of course. But as we think about lubrication and if there are, issues or challenges around that, other than water, I know there are products. What else is
Absolutely. There's tons of lubricants. A lot of lubricants these days are made by doctors. And water-based lubricants, especially for women who might have had some health challenges, so they can't take anything except for a water-based product.
Okay.
There's also lubricant suppositories that you can insert into your vagina 2 days before you think you're going to be sexually active. And the lubrication lasts, and they're tasteless, odorless, and the lubrication really lasts because that is a very, very common issue. And there isn't a lot of education around that. So I always remind women, drink as much, if you know you're gonna have sex, drink tons of water. One. Other things, watermelon has a lot of citrulline in it. So citrulline, we used to think it was only in the watermelon rind, but we've recently, studies in the last 3 to 4 years have found out there's a lot of citrulline in the meat of the watermelon, which is what tastes really great. And citrulline can function as a natural Viagra for both men and women. I have a girlfriend, as an example. I live in Miami Beach, and I work out in a gym with a lot of younger ladies, and I had a girlfriend who's a vegan.
Okay.
She was just eating like some vegan watermelon cake on a diet for like 2 weeks, and she kept saying, I'm so horny. I'm just so horny. I'm so horny. What do I do? And I was like, well, what are you eating? And she's like, I've been eating watermelon cake for 2 weeks. I was like, ooh, that's why you're so horny.
See, I never knew that either.
So pomegranate kernels is another one. So you can, so if you had a diet, if you knew you were going to be sexually active this weekend and you increased your water intake, you had your watermelon, and you had some pomegranate kernels, you are not going to have a lubrication problem. I mean, you could add a suppository to the mix, but there is a such thing as too wet, right?
I knew we were going to have fun today. I knew it. I knew it.
And these are just natural solutions. There's also a lot of non-invasive clinical solutions. So for women who are breast and ovarian cancer survivors, or women who have experienced trauma, so it's very hard. They have what's called dyspareunia, which is like I say, the garage door is shut. So if a penis is going to enter, it's almost like a car coming into a closed garage door. It can be very, very painful, and it's very, very common. But there's things like the O-shot. So the O-shot is it's a procedure where they extract your own blood and spin it, where they really extract the platelet-rich plasma, PRP. Kim Kardashian has famous for a lot of things, but one of her things is she did a vampire facial, a PRP vampire facial. So the O-shot is a vampire facial for your vagina.
Okay.
And it restores your cellular functioning, and it really, really helps it with no hormones. It's only your own platelet-rich plasma. And it can really help improve your sexual functioning and your lubrication potential. And there's other things like the Mona Lisa laser, which is an outpatient thing. You can do it at lunchtime. And it's a laser. You do 3 little laser procedures. You go back to work, and you have significantly reduced pain, increased lubrication, and your vaginal cells start to just rejuvenate themselves. So there's a lot of options out there that we really need more education about, which is why what you're doing is so important.
I am learning so much. The O-shot. So you just go to your doctors, I want an O-shot.
I suggest looking it up first, because not all doctors want to give you the O-shot.
Or can they even give you the O-shot?
Right. The O-shot, the Mona Lisa laser. There's a chair. It looks a lot like the chair we're sitting in. Actually, it's called the Emsella chair. 28 minutes, you sit on this chair. Very pleasurable experience.
Oh, wow.
For men and women both, because men also need support as they age.
Right.
And it will do 12,000 Kegels for you in 28 minutes. And it's a very, very pleasurable outpatient experience. So there's a lot of non-hormonal, clinical beauty spa kind of. They're not pharmaceutical,
Right.
but you do want some sort of a health professional
exactly.
administering them.
Exactly. Now, how did you even become a sexologist? What happened? Did anything where you said, okay, I want to be a sexologist? So
what happened was I grew up as a Black woman in America who I am a heterosexual Black woman. And so when I was in graduate school at Columbia University, I was basically told, you're a heterosexual Black woman, you're going to get HIV. And I was like, no, I'm not. Why would I get HIV? And they said, this is really a big risk factor for women in your demographic. And I was very shocked. So I wanted to learn more about why doctors felt I was at increased risk for HIV. And I do run a lot of HIV studies. I actually run the largest street-based sexual wellness clinic in Miami-Dade County.
Okay.
And through those experiences, I started asking women who were living with HIV and living with other sexual health problems, what were your sexual experiences like?
Yeah.
And what I found out is so many people are out there having sex and not fully enjoying it. And I thought that was a travesty. I thought that was horrible, horrible. Fortunately, I was at Columbia, which is where Dr. Ruth went, America's first sexologist.
Yes.
And I was in a position to continue my education and really focus on what if we taught people how to really harness sexual pleasure, perhaps we could reduce STDs, we could reduce divorce, and we could actually make stronger couples build stronger families, stronger families build stronger communities.
Right.
This is something that's going to be good for the world. So let's legitimize sex and make it easier to talk about sex than it is to talk about the weather. Because right now, we'd much rather talk about whether it's raining or whether it's sunny than whether or not you're having some good sex. And I think sex is a little bit more important than the weather.
Yes, definitely more important. Okay, so you learned more, and now you're actually out there from an awareness perspective, kind of helping people, like you said, have their best sex life.
Have their best sex life. Yes, I have a podcast, Sex in South Beach, and it's always about how do you improve your sex life today or tonight or this weekend, And it's making people aware of the information that's out there and making people aware of how we can self-love. Because when you really, really love yourself, you've never met someone who's having really great sex who's not great to be around.
Yeah.
Right?
Exactly.
People who are having great sex, you're like, I want to be around them. I want to hang out with that person. They seem healthy. They seem fun.
Right.
And I think we need more people like that in the world. I mean, and to break it down, if anyone had sex with our last president, it would have been a better 4 years. Let's be honest.
Hilarious.
I was like, can someone pay that woman to do her husband, please? Pay that woman to do her husband. That's how they started. Okay, I'm going to stop with that.
No,
it's not politics.
I love it. I love it.
But we knew Obama was getting some. That's why he was a good president.
See,
good president.
He was
getting
happy.
some.
He loved his wife and continues to love his wife.
Exactly.
So,
she got looking better. He's looking better. The kids are looking better. That's what good sex
having
can
some
do.
sex.
Absolutely.
Now, what piece of advice, what wisdom nugget, Dr. Sonjia, would you give a woman 40 plus who might be struggling a little, who might even feel embarrassed because she started menopause or perimenopause? And what advice would you give that person if they're struggling a little around the sexual pleasure, if you will?
This advice pertains to a lot of issues, but my go-to slogan is, nobody loves you like you do. Love yourself enough to be courageous about your sex life. It is not an easy thing to talk about. Most of us have had no training in addressing these issues, but your partner is not a mind reader, and this takes a lot of courage. Goes back to courage. one of the biggest issues that I have encountered with people who are over 40 is some people want to have like 18-year-old sex, the same sex they had when they were in college. And often the person who they're interested in or that they want to have sex with wants to have 40-year-old sex, which means they heard about their friend who, ooh, he had sex in the back of a taxi. Ooh, you know, they did this on top of a table. You know, ooh, they used this type of lube. You know, it was some THC lubricant and he went down and got high while he was pleasuring her. And I think having the courage to explore these things with your partner is essential, but it is not easy.
Right.
And so often we think, oh, sex, it should just be easy. No, nothing is easy. Working out isn't easy. Right. Eating healthy isn't easy. Yeah. You know, I do 9 minutes of planking a day. It is not easy. Right? The things,
but you put in the work.
But you put in the work to do what you. So
yeah.
it's like the same thing with everything in life. You get in what you know, you get out of it what you put into it. So if you never address your sex life and you have no conversations about it, then that's what you're going to get out of it. Right. I have an event that date night special where we take couples out once a month. And we introduce them to these all-natural experiments where they can evolve their sexual connection.
Okay.
Often, one half of a couple buys it, and the other half of the couple is very reluctant to experience it. So if your partner really wants to evolve your sexual connection and you're not willing to, we can all predict what's going to happen in that relationship, right?
Yeah.
So I think, you know, there is a couple, they were together for 16 years. And I gave him a feather.
Okay.
Blindfolded her. And I said, use this feather just on the parts of her body that where skin is exposed. Yeah. So it was her arms, you know, her neck area, that's it. He said, I am shocked by her response. I have never seen this in 16 years. What do I do? And I was like, buy a feather.
Get a feather.
Buy a feather, right? So exploring things, being courageous and saying, hey, I don't know where to start. Let's talk about this. And the best place to start, I say, turn on the Sex in South Beach podcast. It's gonna be a super fun 15-minute conversation. And I do all the work for you. Actually, you just listen to it. What you listen to it with your partner, and all of a sudden you're engaged in a conversation you otherwise would never have. And that's really what you need. You need to be courageous and you need to be bold. You need to age bold.
Yeah. Boldness, confidence, kick-ass positivity, all that with sex
all that
as
just
well.
with sex, girl. You got it.
Love it. Thank you, Dr. Sanjay. I appreciate you really talking about a subject that needs to be talked about, and we don't talk about it enough, regardless of what age. And especially, again, as we go through the aging journey and our bodies are changing, and I think some women sometimes feel, my body's changing, so I'm feeling a little way about it. You know, I don't feel as sexy, or, you know, I don't know if my husband, I'm ashamed to tell him I'm going through menopause. So I wanted to always bring topics to share that will be helpful, informative, and educational, as I mentioned before, and you have done that today. But I've got one last thing, a challenge for you, okay? And this is called Crush the Negativity. And I do this with all the guests, okay? And this is a word or words or a phrase that society has deemed negative as women age. So I want you to flip the script. The first positive thing to kind of counter that, let me know what you think, okay? So a quick example, wrinkles, I say wisdom, okay? So that's it, just a few. So first thing, you ready?
Ready.
Menopause.
Can't get pregnant. Thank God I can have all the sex I want. Shoot, I'm not gonna have a baby. Lord, let's do it 3 times. I'm not worried.
See, that should be the slogan for women around menopause. You can't get pregnant. Okay.
Woo, not worried about that.
Aging.
Oh, your fine lines make you fine as hell.
Love it, love it. Last one. Girl, you too old to be sexy.
You don't know what sexy is till you get to my age.
Uh-oh. Yes. Love it. Thank you. Thank you. Again, thanks for all the information, Dr. Sanjaya. We really, really appreciate it. And I know we're going to continue this conversation and continue to stay connected as we move forward. So thank you.
Definitely.
Thank
you for having me.
And Zeal Nation, that's it today. I told you we were going to talk about sex. Sex. So join me next week as we continue these real talk conversations around the aging journey. This is Zeal, Aging Redefined. I'm Stella, your Chief of Aging Fabulous, and I'll see you next week.